You know, the irony is not lost on me that as a physician, in the last 20 minutes, I've been accused of helping lawyers on the one hand, and then on the other hand, I've been accused of helping the insurance companies. I would suggest that you guys go out and meet more physicians because we hate lawyers. No offense to anyone here. And equivocally, we hate insurance companies. So, having said that, I believe it was Justice Louis Brandeis who coined the phrase that states are the laboratories of democracy. So, for my colleagues who have genuine concerns today, rest assured that this conscience law is already the law of the land in 5 other states. Not all red states. The original conscience law was actually in the state of Illinois back in 1977. The second one was Mississippi in 2004. So there is a history with conscience law. We are not out on the fringes here. We are following a trail that has already been cut. And when you ask those 5 states that have conscience laws on the books, do they report any problems with their payer language, which is exactly the same language that's in our bill? The answer is no. I don't know how many times I need to say it, but I will say it again. As a physician, I can get away with this. I assure you, Blue Cross Blue Shield, Aetna, and United do not have a conscience. My friend mentioned the EMTALA laws that are already on the books, ensuring that a person cannot invoke rights of medical conscience when there is an emergency. And my colleagues with genuine concerns will also be reassured by the fact that EMTALA is interpreted very broadly. I heard some concerns about discrimination. My good friend might like to know that of the states, the 5 states with this law on the books, 3 of those states don't even bother to mention discrimination language in their conscience laws. That is something I put in the Florida law. So we go further than 3 of the other states in terms of ensuring that no one's going to be discriminated against. Now, I'd like to tell a little bit about myself, not about the story you already know, but about where this bill actually comes from. When I was a little boy growing up in rural Mississippi, I looked up to our family doctor because we were a small town, and you always knew that your family doctor would always be there for you, and you always knew that he would do what he thought was right. Essentially, you trusted him. You didn't question his motives, and you didn't question his politics. That never came up. But in my 25 plus years of practicing medicine, I've seen society's attitudes towards physicians change. Nowadays, most physicians are actually employed by large corporations whose chief financial officers and accountants try to tell these physicians how to practice and what to think. We have also seen a change in the attitudes of patients themselves, who are no longer making appointments to seek my learned opinion. They are making appointments for a prescription or for a service, a procedure or service that Dr. Google has told them they desperately need. And if that's not alarming enough, in 2020, our own federal government got in on the act. Our government, during the COVID era, tried to tell doctors what was okay to say and what was okay to prescribe. So that's where this bill comes from. I've heard critics on the other side mention the Hippocratic Oath, which is fortunate for me because it's hanging on the wall of my office back home in Navarre. So I know it well. But they tell me to go back and look at my Hippocratic Oath as if somewhere in that esteemed document I'm going to find language that says that doctors should be treated like short order cooks. Well, let me tell you what that oath actually says, because I have it right here. I will use those regimens which will benefit my patients according to my judgment. Not according to a cookbook, not according to an algorithm, not according to the government, and not after consulting with the media and the current trends of the day. My best judgment. That certainly sounds like conscience to me. And I would hope in the case of our physicians that they would follow their conscience, their inner sense of what they should do and what they shouldn't do. And that's really what today's vote is all about, members. Do we want doctors that are nothing more than shills for Big Pharma, taking orders from chief financial officers of large hospital corporations, parroting the talking points of a particular political ideology, taking requests like a radio station DJ without even giving the first regard to a patient's actual well-being? I'm going to leave you with one story. The most humbling question I ever get asked in my clinic is when you're sitting down with a patient, and a lot of times we have bad news we have to give people. We sit down and we talk about their diagnosis, we talk about their prognosis, we talk about their treatment options. Well, when you're given bad news, that's a lot for a patient to take in at one sitting. So we'll sit down and we'll go over the options, and there's always that moment in time where the patient just looks you right in the eye and they turn to you and they say, well, doc, what would you recommend if it were your son? That's conscience. Colleagues, let us allow our doctors, better yet, strike the record. Let us demand that our doctors treat every patient as if it were their own flesh and blood. With that, I close.